Good morning.
Good morning.
Okay, we'll start with the patient in room 220 or 622. Emily is a 10-year-old female. She is alert and oriented times 4. She was brought to us from the emergency department due to exacerbated symptoms of her iron deficiency anemia. When she came to us, she was pretty pale. She had some shortness of breath along with some dizziness here and there. She was also pretty irritable, but she was easily redirected. Her color seems to be coming back. She's on 2 liters of oxygen via nasal cannula. She is able to ambulate on her own for the most part, but we've just been doing some standby assistance due to the dizziness that she had. Emily does not complain of any pain. She always has one or both of her parents in the room.
Have they been involved in helping with her cares?
Yeah, for the most part. I think that they're just kind of concerned about her, and then due to their religion, they just have been sticking around in the room. But for the most part, they're the ones that are helping her to the bathroom and stuff. The call light is accessible for her and her family to use when they need something. They don't seem to call very often though. The family is Jehovah's Witness, so they are refusing blood transfusion, even though that was the original recommendation by the provider. The provider and staff have agreed to use every other option available for Emily to ensure her health improves without having to go with the transfusion route. She has a 22 gauge IV in her left AC that is clean, dry, and intact. It's saline locked currently. She also has a 22 gauge IV in her right anterior forearm that is clean, dry, and intact, and also saline locked. Emily's labs are improving since her initial lab values in the emergency department, but they are still lower than the provider would like to see. If her symptoms do continue to improve, I would suspect that she'll probably be discharged in the next couple of days. Parents have also been given quite a bit of information and education regarding her high iron diet, such as leafy greens, whole grains, poultry, seafood, nuts, beans, and then that she should probably be on a long-term iron supplement. Do you have any questions?
Yeah, do the parents actually seem receptive to making the appropriate changes to Emily's diet?
I think so. I mean, I've gone in there several times throughout the shift and given them like bits and pieces of information, and they also seem to have quite a few questions when I go in there. So I think that they're receptive. I think they're just worried that this is the worst that they've ever seen her, and due to their religious beliefs and them not being able to receive the blood transfusion, I think they're really trying to understand how they can better care for her so they don't end up here again.
Mm-hmm. Has there been any discussion about what's going to be done if Emily's condition deteriorates to a point where a blood transfusion is actually necessary?
Yeah, it sounds like, from what I understand, that the hospital management is aware of her condition and understand, and they kind of explained to the provider that if her condition does worsen, that I think we can take it to the next level, where, I mean, I've seen that before where we've had to get a court order to treat a child with a blood transfusion. Obviously that's the last thing that we want to do.
Mm-hmm.
We'd rather use all the other options first. But yeah, do you have any other questions?
I think that's it for now.
Okay. Do you want to go meet Emily real quick and her parents, just so that you're familiar with her and before I leave?
Yes.
Okay, sounds great. Knock knock. Hi Emily. This is Taylor. She's gonna be your nurse for the rest of today. We just came in to check and see how you're feeling.
I'm feeling okay.
Good. Can we get you anything?
Ice water.
Some ice water. Okay. Do you guys need anything?
No, I do.
Okay. Perfect. All right, Emily. Have a good rest of your day. Okay, honey. She'll bring you some ice water.
Thank you.